Okay. Emily, can you see if we still have folks popping in, or should I just go ahead and get started?
It looks like we had a few hop on in the last minute or so, so maybe another minute or two.
Okay. If Zoom could work out how to do music, that would be great. I guess I could find my own to play, but. All right. Well, it's 1:03, so I'll go ahead and get started. A lot of this will be review for many of you, so we should be able to zip right through. So as you know, we're coming together to do our prioritization, which is one of the last steps in our community health needs assessment for Barry County. We have done a lot of activities to bring us to this point. So we collected quantitative data, which we reviewed at the data preview in November. We analyzed some qualitative data from 8 interviews that we did, as well as a stakeholder meeting. And then we had community input via the advisory committee or stakeholder meetings that we've had, our community survey, and the healthcare provider survey. We did asset mapping, where we looked at what we should be mapping in terms of assets in June, and we mapped that in partnership with Barry GIS, and economic resources were chosen as the focus of that. And then we did outreach via Facebook posts and coalition updates. And then we have a pending publication. We'll talk more about that in a little bit. And then we are going to be doing prioritization today. So if you're just joining us for the first time, I'm not sure if we have any of you that are, but if so, this community health needs assessment process started with the Affordable Care Act, as well as accreditation requirements that local health departments have. And so we do a community health needs assessment and improvement plan to systemically improve and involve the community to identify and analyze community health needs and assets, prioritize those needs, and implement a plan to address those significant unmet needs. So the cycle looks like this. We have our community health needs assessment. We select priorities, which is what we're going to be doing today. And then we have our community health improvement plan, and then our leading to actions that are undertaken by a variety of organizations and coalitions in the community. And then we monitor and evaluate that. So we used for this assessment, we used the county health rankings model of understanding health and health outcomes. And there are quite a few measures in here that we were able to use. And the basic important part of this is the left-hand side, where it talks about how policies and programs influence health factors, which is those physical environment, social and economic factors, clinical care, and health behaviors, which then lead to the health outcomes we see in real life. So the key findings of this assessment so far are these areas of strength, which was housing quality, income equality, food insecurity, and the percent of population with a primary care provider. So those were areas that we did well in. Areas of opportunity are suicide rate, obesity, and mental health provider ratio, as well as disconnected youth. Support for the project was provided by Spectrum, and Barry-Eaton District Health Department. So thanks to everybody who was involved in this. Here's some of their names. So Emily, if you can please put the the data preview PDF file in the chat. That would be really helpful, and I would ask everyone to download it. So what this is the I don't know that I can see the chat, actually. Did you put it in there? Oh, there it is. Okay, thank you. So we have the data preview, which is basically the slides from the last report. It includes 28 measures, the point in time trend and age and ethnicity breakouts when possible. But as we were going through the data, we did get some requests for some additional data. And so I have those in slides here, but we also have those available for you to download so you can look at them as we're going through this process. So Emily, if you can share that one, which is the additional measures. And you did, awesome, thank you. So the first one was, oh, I need to move my Zoom thing so I can see. Okay, so current e-cigarette use, and this is in adults. This is coming from our behavioral risk factor survey. So in 2014 to 16 to 2017, 2019, we saw a really big jump in e-cigarette use from in adults. So that's, gosh, probably 5 or 6 times as high as a rate as we were seeing earlier. And then in terms of Michigan, we saw a jump, but not as big of a jump. So that is what's happened in adults in Barry County. Another measure that what we were asked to talk about and include that wasn't in the original one was current 30-day use of marijuana in adolescents. This comes from the Michigan Profile for Healthy Youth Survey. Unfortunately, there was not a 2019-2020 sample done because of COVID. So we are looking right now at the last 4 times that was available, which the most recent one was 2017, 2018. So unfortunately, we were seeing an increase of marijuana use in adolescents, up to 16.7% for Barry County. That is a lower rate than what we were seeing across the state, which was at 23.7%. So, and again, this is concerning because this is not just have you ever used marijuana ever in your life, this is somebody who's used marijuana within the last 30 days. And again, sorry, this is high school. This would be high school age students. And then we have marijuana use before age 13. So that is, that was actually falling a little bit in Barry County, which is good. So not that we want folks to use marijuana underage at all, but certainly the longer they can postpone marijuana use, the longer they can protect their brains from getting, from harming their development. So it had a lower rate than the state, but again, still a concern. Okay, it looks like there were some people having problems with seeing the stuff in the chat. Has that been resolved? Is everybody able to see the documents in the chat? Cassie says no.
Yes, I'm still not able to see the documents in the chat.
But other people can see the documents in the chat. That's really weird.
Now I'm using Zoom on my browser. I don't know if that would be an issue.
Okay, Liz says she can see them. I think what we will do is anybody that cannot see the documents, go ahead and put your email address in the chat, and Emily will email you those documents directly.
Thank you.
Okay. Sorry about that, Cassie. I don't know what is up with that. Okay. So again, we had community input and interviews. We also had our community survey results. Again, access to healthcare and affordable healthcare were top 2 responses for factors that define a healthy community. Good schools, affordable housing, and access to behavioral health rounded out the top 5. Alcohol and drug issues was the top issue affecting Barry County according to the survey. And affordable access to behavioral health, lack of access to healthcare, chronic diseases, poor access to nutritious food, and mental health problems were also issues that were shared by community survey participants. We know that community members agreed that addressing social needs is important as medical conditions, and most who responded felt they had the resources they needed to stay healthy and can afford to access resources in the community. Most didn't feel there were any cultural or language barriers that kept them from receiving quality care. And then with our provider survey, so these are physicians and mid-level providers, like nurse practitioners and physician assistants. Access to healthcare, access to behavioral health, and affordable healthcare were listed as the top 3 factors that define a healthy community. Healthy, nutritious food and good jobs and healthy economy followed that. Patients' lack of motivation to make health-conscious decisions and low household income were the top 2 factors that's negatively impacted patient health, according to providers. They felt that lack of access to adequate health insurance, high cost medications, and lack of education about health conscious decisions were the following things following those other 2 factors.
Hey, Ann.
Uh-huh.
A couple questions. So on the previous slide, I think you mentioned, or the slide did, there were 400 participants in this survey. And
Yes.
okay, and so most of them didn't have an issue or question with cultural concerns or issues. So my question regarding that is, yeah, there you go, cultural linguist barriers. My question regarding that is, did the individuals that put out the survey, did you collect demographics on the survey? So like what percentage of individuals that would be considered a different culture or minority actually participated in the survey?
Yeah, I mean, I think roughly the participants were similar to Barry County as a whole, which would mean not particularly diverse in terms of ethnicity, racial groups, etc. But Cassie, you're on the call. What would you say about that distribution?
Yes, we found the distribution to be similar to the general public. And we did not have the partners nor the ability to sort of help transcribe and to reach out to the underserved population for whom English may not necessarily be their primary or the language that they're most fluent in.
Yeah, we did do some outreach to low-income populations, but not necessarily those that are particularly diverse. So there primarily would be white participants.
Okay, so I guess just case in point, that's going to affect the results of the survey then.
Oh yeah, yeah. We didn't expect that there would be many cultural or language barriers. That was just one of the questions on the survey. And indeed, we didn't find that in terms of the providers either. They didn't really feel like that was something that was contributing. to ill health. Okay, so what I'd like to do, I'm going to stop sharing for a second because I want to walk you guys through one of the documents that is really going to be key. So Emily, can you please share the document that says Barry Priority Groups in the chat? Okay. So I am going to now share my screen here. Okay, so this is a Word document. I just opened it up. So, oops, that is not the right Word document. How do I get out of this? Sorry, guys. Okay, so when we go to do the prioritization, because we have so many different sort of aspects of health that we need to decide among, what we've done is created some priority groups that some of them represent a single measure, but often they represent groups of measures. So I'm going to lead you through each of these just to give you an orientation into what we're talking about. And then on the right-hand side, it talks about the individual measures that we had from the assessment. So if you go into the data guide, into the data handouts, you'll be able to see what we're talking about. So we have financial stability and economic mobility. So these are things that affect people's finances. Economic mobility means the ability to improve your economic situation, whether that's access to resources so you can better your situation, mobility out of poverty, things like that. So in terms of the measures from the assessment, we had the income inequality measure, which is called the Gini coefficient, because they want to make something sound very complicated, but essentially what it does is it measures how equal or unequal is the community as a whole. And then we have the percent of households below the ALICE threshold. So these are two things that, for those that aren't familiar, the ALICE threshold are those who you would normally count as the working poor. So those are folks that really don't have the resources to be able to withstand a minor economic hardship like a broken down car or, putting down a security deposit, things like that. And then we have safe and affordable housing. So affordable housing improves health in a lot of ways. Quality housing reduces your access to or reduces stress. And then of course, families who can only find affordable housing in high poverty areas may be prone to greater psychological distress, etc. So this is the percent of households who spend more than 30% of their income on housing. So that anything more than that is considered to be unaffordable housing. The next group we have is education attainment. So the measure for this one is the percent of adults over the age of 25 with a bachelor's degree or higher. We know that the more education an individual has, the more likely they are to be able to get a higher paying job, as well as other sort of economic opportunities. And they also tend to have improved health outcomes as well. Social connection and cohesion. We know that social connections and supports are incredibly important. This one is focused at adolescents. So we know the more connected adolescents are with those in their community, the greater protection they have from lots of poor health outcomes. And so this is the percent of adolescents who know adults in the neighborhood that they could talk to about something important. I'm going to scroll down here. Healthcare access and quality. We know that having affordable, good access to healthcare is important to receive those needed health services in terms of preventive healthcare, but also, urgent healthcare needs or other chronic maintenance condition that helps prevent future hospitalizations and those poor health outcomes. So we have a number of measures that are related to that. So adults with no primary care provider, dental care access, preventable hospitalization, diabetes hospitalization, preventable congestive heart failure hospitalization, rate of preventable COPD admissions, and preventable hospital stays. Then we have environmental quality. So when we think about environmental health, we're thinking about clean air, clean water, and clean food, free from toxic exposures, contamination, and also pollution can hurt our ability to access the outdoors. We also have indoor air quality as well, things like lead, mold, exposure to allergens or infectious agents. And so the measures we have for that are rate of elevated blood lead levels among children and air pollution. So in Barry County, lead levels are primarily affected by paint and older home stock, but we do get an occasional lead poisoning from other sources, but we do have the greatest number of exposures are from paint in old homes. The next section is the built environment and transportation. We know that a properly built environment enhances development and well-being of residents and supports healthy behaviors and outcomes. These can include the design of the community, streets, buildings, sidewalks, and parks, and the assets within the community, grocery stores, green spaces, physical activity. And we have the percent of the population living in a food desert, housing quality, internet subscriptions, and transportation accidents. So when we think about the built environment and transportation, we're thinking about how is the human constructed world affecting people's health. And then we have obesity. Obesity is the result of a energy imbalance. It can be sometimes connected to poor diet and limited physical activity. It's related to health conditions like coronary heart disease, type 2 diabetes. I'm not going to list all of those. And we are also concerned for the stigma associated with people with high body weight who may have social and psychological problems as well, stemming from the treatment from healthcare providers and the wider public. So we have the percent of adults who are obese and the percentage of adolescents who are obese. And then we have nicotine use. So we used to call this smoking, but we decided to include nicotine use and broaden it out a little bit because we're seeing, as we saw in the slides previous, we're seeing a lot of electronic cigarettes use, as well as we always see some chewing tobacco and other nicotine containing products. Cigarette smoking, as many of you know, is connected to a bunch of poor health outcomes. And the concern with nicotine addiction is that it may reduce harm to some extent compared to cigarettes, but there's still a number of harms that are related to that nicotine use. So we have percentage of adults who currently smoke, percentage of adolescents who smoked cigarettes during the past 30 days, and the percent of adults who use vaping products. And then in terms of mental health need and access, that's our next category. So mental health is defined as our emotional, psychological, and social well-being, and it also includes, this category also includes the ability to access mental health services when they're needed. This category, we broke out substance misuse from this category, but certainly we do recognize that those two, that mental health and substance misuse often are inextricably linked. I was trying to say the fancy word there, but anyway, they're linked together. So we have the percentage of adults who are saying that they have poor mental health, and then our mental health provider ratio. The next category is substance misuse. So we have misuse of alcohol, prescription drugs, and illegal drugs. And the measures we have for this one are binge drinking, adult binge drinking, adolescent binge drinking, adolescent marijuana use, and adolescent marijuana use prior to age 13. In terms of communicable diseases, well, we all kind of know what they are, but there are other ones besides COVID-19. We are focused on prevention and treatment of communicable disease in terms of lots of different prevention strategies like vaccination, hand washing, et cetera, et cetera. And in this case, the communicable disease measure is percent of non-medical immunization waivers granted. So for those that don't know, when you have, there are compulsory vaccinations that are required for children. And if you, sorry, if you don't want to get your kid those, then you have to get what's called a waiver. And so those waivers can be from your doctor, they can be a religious waiver, and they could also be other kinds of non-medical philosophical perspective waivers. And so anyone who desires a non-medical waiver has to have a meeting with the health department to staff person so they understand what they're declining, but other than that, those are typically granted. So our concern here, of course, is that we are dipping below herd immunity for many of our local school districts. We have maternal and child health. So maternal health outcomes relating to pregnancy and childbirth, child health relating to infant mortality, immunization, proper development, and growth. So the two measures that we have covering maternal child health for this assessment are rate of preventable asthma hospitalizations amongst children and the rate of infant mortality. Chronic diseases, I promise we're almost done. Chronic diseases are those that last longer than a year, and they include things like cardiovascular disease, diabetes, asthma, arthritis. They have a big impact on our healthcare system, both in terms of use and financial burden. Some chronic diseases themselves lead to other diseases. So we have a number of measures here: disability rate, adult asthma prevalence, high cholesterol, high blood pressure, diabetes management education, breast cancer screening, and colon cancer screening. So all of these measures are those that that can affect lots of outcomes in terms of hospitalizations and deaths. And then finally, we have mortality. So this is mortality is another word for death. So those we're concerned with the overall mortality rate, suicide rate, and premature death rate. And so what we would be looking at is to discover, what's driving those mortality rates, and then identify ways to reduce those mortality rates. So that is this document. And what I would recommend as we're going through, we're going to go through our prioritization in a couple different waves, we're going to do several practice votes. But what I would encourage you to do is, as you're thinking about these topics, financial stability, safe and affordable housing, and as you're voting on some of these priorities, to be thinking about the data that you saw back in the previous document and the information that we've shared. So I'm gonna stop sharing this. Okay, Liz wants to know, will there be other measures included regarding substance misuse, such as adult use of marijuana, opioid use, IV drug use, and meth use? So the data that we are including in this assessment is from the behavioral risk factor survey. It's also from the My5 survey. Cassie, do you know of any other additional measures that we included?
With regards to substance abuse, that was it. And one of the things it might be good to mention that the purpose of this assessment is not necessarily to be the be all end all of assessments for the community. There's a lot of various assessment activities that are done, particularly in substance abuse coalitions. That's one of them. The intent of this is to get a broad understanding of the health and well-being of the community, and then develop strategies based on that. Now, for substance abuse, we have an indicator that we use. If that's something that we wind up doing in prioritization, that doesn't mean that we're just working on that particular measure. We are looking at substance abuse as a whole. Does that make sense?
Well, this is Liz. Thank you, Cassie. Thank you, Ann. It makes sense. I know it gives us, I think, of maybe because the community health needs assessment gets seen so wide and so far. Sometimes I think that gives a sense of false security or false impression that our only problems are adult use of binge drinking or youth use of those substances, when in reality, as the coordinator of our substance abuse task force, I can tell you that we do know that opioid and meth use is a major concern, and to not have that reflected in the CHNA may seem like a little short-sighted. Just thinking.
Yes, I agree. And this is sort of a tension that we always deal with regards to assessments like this. We can be very broad or very deep, but it is not necessarily feasible to be both broad and deep. And it is not unheard of for priorities, once they come up, to have some additional data collection or information that is sought in order to help guide what the strategies are used or could be used. Again, this is sort of just like a proxy for, but ultimately, in the CHIP process, if additional information is needed and sought in order to develop meaning well-planned targeted interventions, that's an area where you would sort of do the deeper dive as opposed to here. But you're absolutely right. It's not all the information that's out there with regards to substance abuse.
Yeah, and I think, similar cases can be made for, many other health conditions that we have data on that weren't included in this, particularly, we have quite a few chronic diseases, but there's many more. And, there's quite a few measures that are very unwell measured. So things like environmental quality, we just have horrible local data on that because it's just not something that is very well gathered. So we're left with some measures that are kind of what we have to pull, but ultimately don't give us the great information that we'd like to see. So for example, we don't have good information on the air pollution effects on individuals, who have asthma, for example. But we know that it's significant, but we don't have really good information on that. So so there's a lot of limitations with any assessment for sure. But I'm gonna really quick share my screen again and show you the pulling up just a slide out of the data preview set that Emily put in the chat a little bit earlier. So we have a number of these slides throughout the presentation, and it goes over premature death. Like this one talks about length of life. So this one is that sort of mortality one, and it shows the comparison here. It has a little thumbs up, thumbs down here between Barry County and Michigan. So as you're going through in prioritization, we're going to give you plenty of time, so you have time to go back and look at this data if you need a time to refresh yourself. So here's another example where we're looking at diabetes, mental health, and fair health, and so where those compare. So if you need to go back and refresh, I would definitely recommend that you do that. Here's a health behaviors one that we have. So I'm going to stop sharing that one and go back to this one. Okay, so we're going to move into the practice portion of our prioritization. So the first thing we're going to do as a trial activity so that we can practice how the voting system works before we jump into voting, the actual voting. But this isn't just practice for practice's sake. This is hopefully going to help you to remember those measures from the data preview. And like I suggested earlier, give you time to look up some of those to refresh yourself if you really don't remember. Oh, that's what I just said. Okay. All right. So one of the things that we'll be doing later is we're going to be considering prioritization based on a couple of different aspects of priority. So the first criteria is seriousness. So we're going to be thinking about ranking things in terms of seriousness. So how serious is this particular health issue? We're also going to be looking at control. How much control do we have in order to be able to affect this issue? Some things we would have a lot of control over, and some things we have less control over. And the focus of control here is really as a community. How much control does the community have to affect this particular issue? More so about the community, less about individual people. Capacity. So what's our ability as a community to act on this particular thing? And then finally, catalytic. So if you know about catalysts in chemistry, you know that they make the reaction happen. They make other things happen. So when we think about health issues that are catalytic, we're thinking about how much does this particular issue, if you were to address it, would automatically improve other health outcomes. So quite often when we think about things that are catalytic, we think about the social determinants of health. And so there are things like poverty and education. So if you look at areas that are high poverty areas versus low poverty areas, not being in poverty is really, really protective and improves your health. So those are things that we might think of as catalytic. So we're going to be using a tool called Mentimeter, and we will show, I'm actually doing this presentation in Mentimeter right now. There will be an access code for the activity. So what you will do once you get logged in into menti.com, we'll test out how the voting system works, and we'll go through the exercise by prioritizing the issues. And the way that the prioritization will work on menti.com is that you will have 100 points that you can spread amongst the different things that we're prioritizing at that point. So you can spread them out in intervals of 10. And we do ask that you spread it out to at least 3 different health issues in every vote that you do. So for example, if you were prioritizing a set of factors, you might choose financial stability and give that 20 points. You might choose substance misuse and give that 30 points, and then give 50 points to chronic disease or whatever. So we're asking that you divide up at least between 3, but the number of points you give in an interval of 10 is up to you. Okay, so we've reached the first test vote. And what we'd like you to do first is to go to menti.com and enter the code that you see at the top of the screen. So it's 11155416. And then I'll give more instructions when people are getting there. And so,
And can you repeat that number again, please?
sure. So you're going to go to menti.com, menti.com, and you're going to enter 11155416.
Thank you.
Okay. And this is one of our test votes. And these 4 things, financial stability, economic, environmental quality, social connection, and education, these were chosen at random, but they're allowing us to focus in on just these measures and practice doing our voting. So what I would encourage you to do is think about, given everything we've talked about and the data that you've seen in the past, think about which of these measures, you know, how many points would you give each of these measures? And we ask that you give points to at least 3 of these. If you want to give points to more than 3, that is absolutely fine. And Emily, can you please verify for me that you've been able to go to this and it is working?
Yeah, it works for me.
Okay. Okay, Tammy, you are welcome to vote, even though you've not been part of the process up to this point. Your input is important. What I would request is that you use your knowledge of the community in considering how you might vote. And as well as everybody else who might be here for the first time, you are welcome to vote. We welcome your participation. Okay. Felt like I talked for a while about this, but does anyone need more time to do this practice vote? This is not counting towards the final prioritization. Emily, do you see anyone like frantically waving or raising their hand?
It looks good.
Okay.
Actually a pretty cool tool.
Oh, wait. Are you guys seeing the results?
No, I think you have to press the S so it hides your image.
Okay.
Looks like nobody voted. It says results are hidden.
Yeah. Keyboard shortcut H. Oh, there we go. Okay. Sorry, that's the first time I've used this tool. Okay. So what we've seen here is that we have 34% for financial stability and economic mobility, followed by education, social connection, and environmental quality. So thanks, everybody. So we're going to go on to test vote number 2. Emily, can you guys see this on your screen or not?
I can.
Okay. So this is going to be very similar to the other ones. Consider safe and affordable housing, communicable disease, substance misuse, and mortality. And again, we're just asking you to assign points in terms of the priority that you feel they should have in terms of our community plan. And again, the reason that we do this is because it's really difficult to decide between safe and affordable housing and communicable disease. Like, they're both things that you want to improve on in the community. But ultimately, when we come to deciding what things are most important to work on for both the hospital and the health department, and as well as all of our other community partners that are interested in health, this is part of that process. So anybody who needs more time.
And this is Liz. The voting screen is not up.
The voting screen is not up. Do you have to scroll down? Can someone help who's on the site? Emily, maybe?
Yeah, if you go to menti.com and put in that code at the top.
Okay, there it is. Sorry. Okay, I see it now.
Okay, anyone else need any help? I will say, it is a lot more fun to do this with ping pong balls in buckets than it is to do to do virtually. I appreciate you all for sticking through. And maybe next time we can do this in person. Okay, I'm gonna press H like I did last time and see if it comes up. Okay, perfect. So we had safe and affordable housing, substance misuse, communicable disease, and mortality. Great. All right, we're going to be going to test vote number 3. So again, you're going to go to menti.com and use that particular code. And I think you should be able to see test vote number 3. And, oh, I didn't hide it. And so for this one, we're going to be looking at healthcare access and quality, chronic disease, built environment and transportation, and nicotine use. It's kind of cool actually to see as people's votes come in, to see things change up a little bit.
That's very cool. You're doing a great job, Ann.
Thanks. And I have to say thanks to Chris for setting this up, because I didn't set any of this up. I'm just struggling to make it work. So thank you so much. All right. Okay, nicotine use now switches in places with built environment and transportation. All right. Anyone else need more time? Oops, sorry. All right, we're going to go on to test vote number 4. This one is only between 3 things. So we've got maternal and child health, obesity, and mental health needs and access. So if you compare these things to each other, which ones do you think might be the most important? Everyone a couple of minutes to think about this one. Feel free to go back, take a peek at the data. Okay. I'm gonna unhide this. See where we are. We've got mental health needs, obesity, followed by maternal and child health. Okay. Anyone else need more time? Oh, they just switched places. This is very exciting. Yes, Patrick has a good point. It may skew participant decision-making when rating if you can see the immediate feedback results. So in the final vote, we will not be sharing it until we've closed voting. So thank you for that. But keep in mind, this is just for fun. This is practice. And it's also to encourage people to remember some of the measures that they saw in the past. Okay, so I haven't seen much movement. I think most people are done with this one. All right. So thinking about those 4 votes, were you surprised with what measures came out on top? Were you not surprised? What reactions do you have? Any thoughts in your mind why the winners of this activity won? And do you think any of the losers should have won instead?
This is a quiet crowd. I was surprised by the last one. Not surprised because mental health was at the very, very top. I was surprised that OB and obesity were so closely related.
Thank you. Rhonda had a question about vaccination rates in schools. Have we seen a decline in vaccinations, not counting COVID? So yes, because COVID shut down immunization programs and people were doing virtual visits, or in terms of the health department, we just weren't doing immunization clinics. We have seen slight declines in vaccination rates for children in particular. So yeah, our focus is on getting those vaccination rates back up to what they were pre-COVID and hopefully even more improved as well. Any other questions or discussion? All right. Well, then I am going to keep going here. So I do have a break scheduled, but I'm of the opinion that sometimes it's better just to keep going. So I'm going to stop my share here so I can see people again. Anybody really need to take a break, or should we just keep going?
Keep going.
Okay. I think I heard somebody say keep going.
That's fine.
All right. Thanks, guys. All right. Go back to share my screen. All right. Okay, so we're going to do 4 votes again, but instead of only voting on a couple of subsection of the measures, only a couple measures at a time, we're going to be voting on all of the priority areas at once using the 4 different criteria. So we already talked about this a little bit before we voted previously. So we're going to be looking at seriousness. How much of an impact does this have on people's health? So if you think about death or major disability, that has a big impact. And maybe some of these other things that are affecting people maybe have a little bit smaller of an impact. Although you can certainly think of seriousness as the effects it has on all health outcomes. So really the seriousness, how serious do you think that particular issue is for Barry County specifically in terms of that priority, those priority areas? And then we have control. How much control do we have to affect this health issue? Capacity, What's our ability as a community to address the health issue? So we might say in Barry County, we have a lot of capacity for this or a lot of capacity for that. And so that's where your knowledge of community resources comes into play. And then catalytic, how much does this issue affect other health issues? And we're going to go through each of these weighting criteria. As I explained last time, I'd like you to spread out your votes amongst at least 3 different priority areas for each section. If you're voting on your phone or your computer, you may need to scroll down to see all of the options. And then we will be using a weighting measure for each of these different criteria that I will explain later. But essentially what we will have to do is to actually take the votes that you guys submitted, take the rankings, and then we will put them into a spreadsheet. We will show you the spreadsheet, and then we will come up with a final ranking for priorities. So just bear with us. It's a little bit data wonky, but we promise hopefully it will make sense in the end. So the first thing that we need to do is move on to the next slide here. Oh, and this just lists out the categories, and you guys have these categories also, of course, on your Word document. Okay, so this one is going to count, so keep that in mind. And we're asking you to rate all of these in terms of seriousness. How serious is this health issue? So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15 different areas. These are listed in a random pattern to try to address any sort of bias in the order of the measures. And so I would invite you guys to go in and submit your votes. So you can divvy up your points amongst many of them. You can put the bulk of your points into one thing, but we would ask that you at least put some of your points in 3 different priority areas. Okay, Emily, are you able to work this vote? Is it working on your end?
Yeah, it looks good.
Okay. All right, so I'm going to give about 30 more seconds. If you need more time than that, please speak up or put something in the chat. Okay, last call on needing more time. All right, I'm going to go ahead and advance here. All right, control. So how much control does the community have to affect this issue? So again, these are the same measure or the same priority groups. We'd like you to follow the same rules. Please spread your points amongst at least 3. But you can certainly do more than that if you feel passionate about it. And Emily, just to verify that you guys can see this particular question.
Yep, I can see them.
Thank you. Okay, we've got 15 people voted. I'm going to wait about another 30 seconds. If there is anyone else who needs more time after that, please let me know. All right, anyone who needs any more time? All right, I'm going to go ahead and advance. And this one is capacity. What's the capability of the community to act on a specific issue? And again, this is the same thing as before, at least 3 things, at least 3 priority areas, spread your votes among, but you can do more if you'd like. Okay, and we've got 14 people who've submitted their votes. So I'm going to give it another 30 seconds or so. Let the last few people vote. Okay, is there anyone who needs a little bit more time? All right, I'm going to go forward. And catalytic, how does this specific issue affect other health issues? So again, when we talk about things that are catalytic, they're things that if we were to magically take care of it, all the other things would tend to improve alongside of that. And again, please spread your votes out to at least 3 categories. More is fine. All right, 16 people have submitted their votes. I'm going to wait a couple more seconds to see if we can get anyone else. All righty. Thank you, everyone. So we are going to go, I'm going to stop sharing my screen and we're going to go and share our votes accordingly. I'm going to have to do that in partnership with Emily. So hold on while I'm doing that. I'm going to stop share here. All right. So while we're doing this, if there's anyone who wants to tell a funny story or wants to share something important that they think the rest of these folks should know while I am getting my spreadsheet together, please let me know. Go ahead.
I'm just wondering who this Lacey Forbes is. Is that a new person in our community?
No, Bernie, I think it's Lanny. Her daughter must have used it.
Got it. Okay. I was gonna just pick on Lanny, that's all.
She stepped out. She had a medical.
Got it.
This is hilarious.
I would just put forth a plea to people to continue to use good hand washing practices, wear their masks and socially distance. Our hospital's full and has been full and really stressed at the seams, doing a good job, but we need to get people healthy.
Okay, Emily, of course, I can't get the Google Doc to open, so I'm going to send it to you. I'm going to send this link to you. Okay, Emily, I have sent you an email. Can you get that Google Doc to open?
Yes, I can.
All right. Can you go ahead and share your screen?
Yes, I can.
Okay. So what we will be doing here, Emily, is I'm going to be reading out the scores to you, and then you will be entering them in to this tab is the the raw score, and it'll automatically populate the weighted score. Okay.
Okay.
So now I need to go into Mentimeter. Hold on a second. And if anyone doesn't want to hang on for this very, very exciting raw score reading, we will send out the results to those who registered for the event shortly, and just in case, just so that if you don't want to hang out, you don't have to. But anyone who wants to is welcome to do so. And it is very exciting, but I totally understand if you have other important things to do. All right.
So Anne, with the process, is this presented later or is it what it will be concentrating on? This is the vote, right? Okay.
This is the vote. Yep. And so we have the results. We will have the results shortly. It just, we have to follow our weighting criteria. So it takes a little bit of time.
Sure. So once this is all done and we find out what those are, then our next meeting is about planning around those.
Absolutely. Yep.
Actually, a
we will
little bit of a clarification on that, right, is from this, we'll come up with our top 5. And then from the top, go ahead, Ann.
Yeah, so usually for community health assessments, it's usually somewhere between 2 and 4. We could go with as many as 5. However, I think we've gone with 3 in the past as it's sort of more manageable.
Yes, we'll come up with the top 5 here, and then our IS team will have a meeting on January 4th here for the hospital to come up with our top 3 of the top 5. Am I saying that right, Cassie?
Yes. 5 would be ideal, and
Yeah, I
because we
wasn't aware
want
there was some sort of
to narrow down
hospital
to 3.
process.
But 5 would be ideal. 4 is okay. 3 doesn't leave us. 3 sort of takes any kind of decision making out of the hands of our community board.
No, we're going to have.
Or we would like to give, we would like to give them options.
So I think what I would say though is that it's important that the community, so that's what this group represents, is the one who's choosing the priorities.
Right.
You guys can pick as a hospital or as a health department, we can pick what we're going to work on. But for the community, it's important that they choose the priorities. So that's what you guys are doing during this event. So whether we end up doing plans around 5 or 3 or however many that is, ultimately the priorities are what the priorities are. So, okay, Emily, are you ready?
I am ready.
All right. So what's that?
Sorry, I didn't mean to add any confusion. I said I just wanted to make sure if anybody was going to drop off that they didn't miss out on some important input.
Yes, so we will be getting back together. And I'll have a slide on this at the end, but we will be getting back together to work on the community health improvement plan in the spring. Okay. So Emily, what I'm going to do is I'm going to tell you the rankings and you're going to enter the number into the slot where it goes. Okay.
Mhm.
All right. Mental health is 1.
Is this for seriousness?
Yep, this is seriousness.
Okay. Got it.
Safe and affordable housing is 2. You tell me when you're ready because I can't see your screen.
Yeah, I'm just not seeing that one. Oh, affordable housing was 2.
Yep.
Okay.
Substance misuse is 3.
Okay.
Financial stability is 4.
Okay.
Healthcare access and quality is 5.
Okay.
Obesity is 6.
Okay.
Nicotine use is 7.
Okay.
Social connection and cohesion is 8.
Okay.
Chronic disease 9.
Okay.
Maternal and child health 10.
Okay.
Mortality 11.
Okay.
Education 12.
Okay.
Built environment 13.
Okay.
Communicable disease 14.
Okay.
And environmental quality 15.
Okay. I got them all.
Fantastic. Okay, which column is next? Is it control?
Yep, it's control.
Okay, healthcare access and quality is 1.
Okay.
Mental health needs and access is 2.
Okay.
Environmental quality 3.
Okay.
Safe and affordable housing 4, or affordable housing 4.
Yep, got it.
Communicable disease is 5.
Okay.
Social connection is 6.
All right.
Substance misuse is 7.
Okay.
Built environment is 8.
Okay.
Nicotine use is 9.
Okay.
Education is 10.
Okay.
Maternal and child health is 11.
Okay.
Obesity is 12.
Okay.
Chronic disease is 13.
Okay.
Financial stability is 14.
Okay.
And mortality is 15.
Okay. Got them all. And the next one is capacity.
Okay, number 1 is affordable housing.
Okay.
Number 2 is mental health needs and access.
Okay.
Number 3 is healthcare.
That was number 3?
Yeah.
Okay. Yep.
Substance misuse is 4.
Okay.
Social connection is 5.
Okay.
Education is 6.
Okay.
Nicotine use is 7.
Okay.
Obesity is 8.
Okay.
Communicable disease is 9.
Okay.
Financial stability is 10.
Okay.
Maternal and child health is 11.
Okay.
Built environment is 12.
Okay,
Environmental quality is 13.
okay,
Chronic disease is 14.
okay,
And mortality is 15.
okay, got them all.
Fantastic. Only one more.
Sweet.
Are you ready for catalytic?
Yep, I'm ready.
Okay, mental health is 1. Financial stability is 2.
Okay,
Safe and affordable housing is 3.
okay,
Healthcare access is 4.
okay,
Chronic disease is 5.
okay,
Obesity is 6.
okay,
Substance misuse is 7.
okay,
Social connection is 8.
okay,
Education is 9.
okay,
Maternal and child health 10.
okay,
Communicable disease 11.
okay,
Built environment 12.
okay,
Mortality 13.
okay,
Environmental quality 14.
okay,
And nicotine use 15.
okay. Yep, they're all in here now.
Okay, I'm going to escape out of this. Okay, so go ahead, Emily, and click on when it says weighted score.
So this weighted
Okay.
score here.
That is the weighted score. And then if you go up to sort the data by column F, that's what we want.
Which one do you want?
Oh, I don't know. This is an Excel, so I don't know how to make it do it, but we need to sort by column F.
Oh no, I didn't mean to do that.
Or we can just look to see which got the highest scores.
Yeah, it looks like,
Click on the
Oh,
up corner
sorry,
left.
it's lowest score is the best. Sorry, I forgot this is golf scores.
oh yeah, that's right.
So, okay, so go ahead and scroll up to the top and I'll explain what the weights mean. Okay, so in terms of seriousness, seriousness is weighted the most. The way that this is done, because we had rankings, we had to do a golf, this is a golf score thing. So the lowest is the most important. So seriousness has a 1, control was weighted a 2, capacity a 3, and catalytic 4. So catalytic plays a role in this, but not as much as seriousness in terms of all of these different scores. So what we've done is we've said, okay, we're looking at all of these different aspects of prioritization, but ultimately we think seriousness is the most important. So if you scroll down through this, if we can't figure out how to sort it, I think,
it looks like this one is the lowest.
yeah, and I think that's actually mental health. So we have mental health first, followed by affordable housing. Then we have healthcare access and quality. Can you highlight those rows,
Yeah,
please?
I was just about to do that. Let's see.
Thank you.
Okay, so there's affordable housing.
Yeah, and Chris just forgot to change this. It needs to be, can you write mental health, please?
Yeah.
Thank you. And then we have one that's 32. And then I think I saw one in the 50s. Go ahead and scroll down.
Yep, substance.
And then do we have anywhere that's near to the 50s or 60s? There's a 70, there's a 67.
Looks like this one
Oh,
is.
social connection. go ahead and highlight that one because we haven't gotten to 5 yet.
Yep, and this is the,
Okay.
do we want more than 5?
I don't think so, because I think then it gets really complicated, but we do have at least I think a good selection here for folks that want to take this and use it for their own processes. So what I would point out is when you look at this, you'll see that we have the first 3 are really concentrated towards the bottom. So you've got 25, 32, 15, and then you have a big jump up to, well, not a big jump, I guess, to 32.
But 67 and 57.
67 and 57, yeah, are kind of a big jump. So, so here we are. These are the priorities, at least from this process. And we just thank everybody who's still here on the call for sticking it out with us. And we will be sharing the results of this with those that have registered. All right, and I'm just gonna switch back over to my slides to make sure there isn't anything else that I need to. Okay, so the other big thing that needs to happen is that we need to have a final report. So we've been working on that in partnership with Spectrum, but that final report will have the results of the prioritization process, as well as all of the data in one place so it can be more easily accessed. And then we will have an opportunity for folks to get together, and let me just double check timing here. So we're going to be communicating that report to the public. So we are happy to present at a coalition meeting or community meeting, or really anything that you want us to come and present the results of the community assessment to. We'll be sharing it by email and by social media. And then we will also have, we'll be able to start our community health improvement plan. So what we have is a community health assessment, and that just gives us, okay, what's the issues that we're facing and what is our priorities? And then we have to actually do something about it. So we're hoping to make the CHIP process this time a lot more collaborative and a lot more engaged than we have in the past. We're still not sure from a health department perspective what our time commitment will be in terms of facilitating that because of COVID. We have just a lot of competing priorities for sure. But typically what our partners do with this information is once we have a report and we have priorities, then we're looking for opportunities to build on the work that is already going on out in the community. And that includes our coalition partners like the Substance Abuse Task Force, as well as other partners like Blue Zones or other folks that are looking to improve health in whatever way out in the community. And one of the things I'm most excited about is we have a couple new priorities this time. So we have affordable housing, which has not risen to the top of a community health assessment before in Barry County that I can remember, of the ones that I've been involved in. So what that means is that we're having a lot of recognition this time that housing is really going to play a big role in how we're thinking about health for the next couple of years. So I'm very excited about that. And look forward to re-engaging with our housing partners to feel out how we can assist. And ultimately, the point of this, I think, of our community health needs assessment, as well as our community health improvement planning process, is to figure out how we can work best together. And whether that's bringing new partners to the efforts that already exist, or if they don't exist, then starting new efforts. So very excited about that. And with that, I am going to close the meeting, but I am happy to take any questions, concerns. Emily, feel free to go ahead and share that list again, if you will, for those that would like to see it.
Yep, I just shared the list in the chat.
Oh, you did? Okay, perfect. Okay, any other questions, concerns? Thank you for sticking with our weighting criteria. We really appreciate it. It's a little bit more work, but we really feel pleased with the results at the end of it and feel like it's a great representation of the community's views on what's important to you guys in terms of health.
Thank you very much. Good job, Ann.
Thank you. I appreciate it. All right. Bye, everyone. Emily, if you can stay on for a minute.